It's Dr. Jen or Dr. Baker from drjenmed.com. Today I will be teaching on lung infections in the elderly. This is like my baby because I enjoy teaching about taking care of the elderly in home. That's what I do. I'm a house call doctor and I teach people how to take better care of themselves at home. All right, so a lung infection, your lungs are needed for breathing so oxygen can get into the blood. Now, the elderly, the older people, they are at an increased risk of having a lung infection. Now, this video is suitable for people who have elderly relatives at home, especially if they are mostly in bed or they have many diseases, high blood pressure, diabetes, they have a stroke, they've had a heart attack, so their immune system is a little weaker than normal. I'm going to give you some tips. Hi, Yvette. Give you some tips about how to deal with pneumonia. I'm just excited just teaching this, right? So, a pneumonia is an infection of the lung. It may be a bacteria, a virus, a fungus, a parasite, whatever. The most common type are viruses and bacteria. Now, I'm focusing it on the elderly because their body tend to be immunocompromised. We've heard that term a lot. What does immunocompromised mean? It means that their immune system is not functioning at its 100. And why does that happen? Why does the immune system not function? We'll get into that. What is the immune system? What is the immune system supposed to do? The immune system is a part of the body whose job is to fight off any foreign germ, any foreign thing that it don't know. So whatever is not supposed to be in your body, your immune system is going to be like, okay, I don't know you. You should not be here. Get out. That's the job of the immune system. Now, every cell in your body needs certain things to grow, to heal, to repair, to divide. If they don't get it, the immune system starts, just like with other cells, it starts to weaken. Those cells start to weaken. They get damaged. They don't heal properly. They don't grow. They don't divide. It's as basic as that. And I'm very basic. I'm very simple. So just as how a regular cell in your heart, in your skin, in your muscle needs these things, your immune cells need these things. What tends to happen in the elderly people is that a lot of them are bedridden. A lot of them stuck in the house. A lot of them lose them appetite. Them not eating, them not drinking. So the basic stuff that the cells need to be healthy, they are not getting it. Do you understand? This video is for all of you people who have elderly relatives, or even if you yourself, or you may not even be that elder, but you realize your body no 100. This is for you. Because these are the things that will make people more prone to catch germs. So how do we compromise our immune system? We talk about high blood pressure, diabetes, all of them big disease. But it all starts off with, are you drinking enough water? Are you drinking enough water? Is this elderly relative of yours drinking enough water? It sounds basic and I hate for sound so basic, but it's the truth. When you talk to people, if you don't mind shop a 2 glasses of water, them drink for the whole day. And I'm not kidding you. And then them say, well, I did drink a little juice. I did little. Are you eating good food? A lot of the elderly people, them appetite low, so them don't want to eat. And God bless the little them eat. When you don't eat, let me calm down, I'm too excited. When you don't eat, then you're not getting the nutrients that your cells need. So the malnutrition contributes to your immune system being low. All right? Then them lock up in the room. Yeah, we all go to the yard already and you see the old people, them lock up in this little dark room and the room smell frowsy. Smell like Bengay mixed with urine. Not true? Right? Yes. Right. Yeah. So what? You think that's fresh air? You think that's nice, good oxygen? No. That is air pollution. Right? In a form. So that is the air that is going into the person's lungs. That is the air. Right? Now, So we talk about them not drinking enough, them not eating properly, the air is not good. A lot of the times, they do not get up and move. Even the ones who can move a little, them just lie down. You cannot have your elderly family lie down in the bed the whole day. Do not do it. I don't believe in it. Do not do it. Apart from causing pneumonia, you can cause bed sore, and I can go on and on and on and on. Clots in your legs. I can't, like, if I teach on this, it would take the whole day. All right? So what I'm saying is, these are the things that compromise the immune system. People love to say it's diabetes and pressure. It's not diabetes and pressure alone that compromise the immune system. If you're not eating the right food, if all you're giving them is liquor rice, a piece of wing, that is not enough. Now, a lot of you love to, remember, these are my opinions. This is my observation in my years of being a doctor and just understanding health. A lot of you love to give Supplygen and what other one? Horlicks and Milo and Ensure and them something there. Look here, me not kill no brand out there, to be honest with you. But the food we grow out of God, Master God, earth is what you need to give old people. Let me say that again in proper English. The food that the elders should get should be food that comes out of Master God earth. Can I get an amen? Amen. Let me give myself the own amen. So, if them can't even eat the solid food, maybe because they have an issue swallowing, like maybe they had a stroke and can't swallow good. Carrot, chocha, you can blend it up for them. Puree it, crush it like how you would have the baby food. This whole heap of Milo and Supplygen and them foolishness. No, give real food. Make some soup. Make some soup. I believe in a soup like wow, you know, soup. In the soup now you put in your garlic, your onion, your ginger, your thyme. You put in a little chicken for little protein, not too much. Your Irish, every nutrient you want, give, boil it up. And that is like a medicine in and of itself, because you're giving the nutrients. Those of you who have a blender or a juicer, all you do, you peel the vegetable, then put it through the juicer, and the real juice of that vegetable is nutrition to the cells. I know it sounds basic for me talking about this. Boy, Ensure is if I don't have none else. If I can't make my soup, if I can't puree my food, and push come to shove, then I go to Ensure. And you have to watch the sugar in Ensure. Right? So anyhow, nutrition. Malnutrition is what compromises the immune system. I already tell you, dehydration. You're not drinking enough. If you don't drink enough, the normal water that is in the lungs. Because remember, the water, there's water in the lungs. A little. I don't want you to get it confused with when people have heart failure. There's a water in the lung because the air has to dissolve in water to go to the bloodstream. All right? So if there's not enough water, everything gets sluggish, thick and viscous. Think of it like heavy duty oil. You get me? So when you get all of that, you know who love the muck and the mucus and the yuck? Who love it? Germs, bacteria, them love that. Them and the fungus, them love that environment. Which is why even asthmatics need a lot of water to keep the liquid just flowing. You understand what I say? I know this sound like ABC 1, 2, 3 now. But this is, let me tell you already, nutrition, the water, these are the things that compromise the cells of the immune system. That's what immunocompromise. These are the things that compromise. So when them compromise now, a germ say, oh, you? Yeah, you look like a nice place I can go live. Right? Now, when they're in bed for too long, what happens is that the secretions in the lung just stay one place and gather. And again, a germ can come on board. Right? Breathe in. When you exercise, apart from stimulating your white cells to fight, Just by virtue of breathing, it allows air to go in and out of your lungs. Now, if you are not moving up and down, your breathing is more shallow, right? And if your breathing is more shallow, you are not getting a lot of oxygen, and you are not getting what needs to come out, the carbon dioxide out. So these are the factors that make the elderly sicker. You think it's medicine, you think it's this, is the basics. I always tell people, you know, the most important of recovery is the nursing care. You might not have a practical nurse because of corona, you might not, but me I teach you when me spend how much millions of dollars at medical school for learn. I learn in real life. My grandmother, my grand aunt, she named Auntie. If you go on my website, you'll see her story. Auntie had a stroke, right? And the stroke, she had a second stroke where wicked knock her down, right? So I've been there, me go through it, so me know what me I tell you. Me not tell you from no textbook perspective, all right? All right, so we know the things that compromise the immune system, all right? The germ come on board and cause this infection. And infection now you have pus and yuckiness and congestion and cold and all of that. This elderly person, them in the room, them not get no sunlight, no vitamin D. Them not get no fresh air, them not exercise, them not move about. So everything just sluggish and yucky. We understand all of that, right? Now, it starts off with a little cough. Maybe a dry cough. Then it starts sound wet, like Jamaican would have said, cold on the chest, congestion. And then now, them start might, let me teach you some stuff. Older people, they might not get no fever. They might feel actually cold. Them skin, you know, like how mine look nice and pink. Them just have a little dusky, you know, weird look. Them finger, them feel a little cold, clammy, you know. When you're talking to them, it's like them in and out. Them a little confused. These are the early signs of an infection in an older person. You cannot wait till them short of breath and a blow hard and wheezing before you realize that this is a lung infection. Once them lying down too long in the bed, not get no fresh air, sun, food, water, all of that, you must be looking out for these things, because as sure as day follow night, it will come. That is what kill most elderly people. From them lie down in that bed so them not get up. The germ come. So the cough, the cold, those are the symptoms. Them lose them appetite, them energy very low. They're very weak. Them start to feel cold and all of that. Those are the signs of infection. Once an older person has an infection, a lot of the times them get confused. Even a urine infection will make an older person confused. Understand what I say? So that is what happens. When it get really bad now, you see the chest will move like seesaw. You see when it starts to the mouth like this now? Right? So you have to do all of that to prevent it from reaching to that bad point, because that germ, if that germ gets into the blood, it's a whole different kettle of fish. It's a whole different kettle of fish. So what is Dr. Jen saying? Me prefer prevent a problem, you know. You don't prefer prevent a problem. If you or somebody you know is at home or you need to get moving, make them do some deep breathing. When them in hospital, what do you think them make them do? They make them, can't find out to show you. I'm trying to show you. They get like a balloon or bag, and they blow into the bag. Look at me. And they try to get them to blow out all the air out of them lungs. That deep breathing, they do that. The physiotherapists do that. The physiotherapists also knock up the back to loosen up the secretions, which is why I say it's important to drink, to keep the secretions nice and moving. All right? So when it gets into the blood now, we have what you call sepsis or septicemia. That require immediate hospitalization, immediate whatever. So my job today is to try and teach you little stuff you can do to avoid it getting to that level. All right? To avoid. I think I've taught you a whole lot about how to prevent the immune system from being so compromised. Because if you make them eat properly, you know, the sugar now go high. You see me? If them eating properly and taking their medicines as needed, the pressure won't be so high. All of those things, and they will be healing right. Listen, I'm telling you from God honest experience. Right in front of your eyes, you will see recovery. Right in front. And it's a journey. It don't happen in one day. You know? But you have to be consistent with anything you do. Water. Nutrition. I mean, I mean food now. I mean real food out of Master God earth. Them get little sun, fresh air. Them cannot be in that rank room. Sorry to say this. Sometimes I go to people and I see even them feasting. Come on, man. We can't do that to our elders. We cannot. Alright? So, we know how to prevent. And I want to... I'm winding down now. So, the other thing I'd like to say too is that one of the other reasons why you don't want them lie down in the bed and get a stasis situation where the stuff not moving is that they can also get clot in their legs, in the veins. They call it a DVT, and that can spread to the lungs. So those are that. There are so many things I could talk about, but I'm just limiting it to say, as much as it's possible, have them sit up in the bed, right? That maybe that's all them can manage to do. When them sit up, do some deep breathing with them several times for the day. All right, maybe you do 3 at a time, and you do that maybe 4 times a day at first till they can do more. You gradually feed them with the right food. They cannot eat a lot, maybe just a small amount. Maybe them can only manage an ounce at a time of the pureed foods. You give them a little at a time to eat and make them. Now, as we're talking about eating now, if they cannot swallow properly, and let me tell you how you check if them swallow properly. You can use like a straw or a spoon. Put it at the back of the throat and see if them try to gag or choke like this. You put it in. That means they can protect them airway. Some people who have had a stroke. Now this is so important. Listen properly now. Some people who have had a stroke, the nerve that supply here don't work properly. Alright? So what happens is that when you put that, they don't choke. They don't feel like they're going to choke. So what that means is if they are eating and choke, the food can go down in Jamaican style in the wrong passage. Right? So it is very important, especially if you've had a stroke, to check that part, to check them to make sure them when them swallow, it goes, they can protect their airway properly by doing what I just tell you. But let us start at the basics. Fluids, slowly. Even if it's an ounce at a time, them can manage. Puree the food. Right? Little at a time. Soups. Them I believe in vegetable juice. I believe in it. Right? And we come from Jamaica where we can get the real deal food. Right? We give them a little at a time. Them get some fresh air. Then get a little of the morning sun. Right? Give them a little nature. Make them smile. Make them happy. I mean, we can't make them happy, but allow that social interaction. Make the pitney them play with them. Make your children them do a little dance for them. Make them smile. Comb them hair a little. Make them feel beautiful. You understand? So take care of them. That lifts the spirit. That reduces their stress. Because a lot of the times, them lying in the bed and they feel depressed. Them feel lonely, especially if them lose them spouse. Them feel, you understand? And these are the things that compromise the immune system. And when the immune system compromise, the germs them say, oh yeah, find another host that I can go make sick. So we would much rather prevent a problem than fix it. But if the person does have the symptoms, what you would need to do is that they would need to see their doctor. You understand? So from you see any change in behavior, so they're more confused, loss of appetite, loss of energy, as I tell you, feel cold, feel hot, coughing, whatever, do not play. You have to treat elderly people like they're babies in terms of their immune system. You understand? And even with the medicines, some of them cannot swallow the pill. That's another issue. So sometimes the doctor might have to give the antibiotic in a liquid form. you know. And another thing with the elderly is that the medication they get, sometimes the dose might be too strong for their body. So that's another thing you have to look out for, side effects. But that's a whole different topic, which I'm not going to today. So just to summarize, okay, we're taking care of people with pneumonia at home, right? It could be bronchitis. Bronchitis is very similar to pneumonia. You have congestion. Think of congestion as a phlegm and the muck and the, what my grandmother used to call it? She have a word she used to call it, you know, the congestion. Can't remember. Anyway, you know, we have that, and then you have the germ, right? And what I've said to you is that the elders are more prone to it because they are lying down in bed, stuff not moving, them easier to choke, so the thing go down in the wrong passage, the food, whatever. Them not getting the fresh air to breathe good oxygen. Them under stress emotionally. Them not eating properly, them not drinking enough water. So all of these factors compromise their immune system. Plus if them have sugar, pressure, cancer, whatever other issues them have. So we take our time and you make up a little plan. You see how much things I just teach you? You just get a paper, you write down everything I just said. Listen to the video 10 times if you need to listen to it. And you just make up a little plan and you say, all right, mama today must get, suppose you say she need to get 8 glasses of water. All right, mama, 8 glass, water, 8 glass. Food, this amount, 6 times for the day, 4 times for the day, however she eat. It's so you do it. It's so you do it. It's so you work a care plan, and you will be very similar to what nurses do, right? But this is what get people better. Okay? All right, and this has been Dr. Jen from drjenmed.com. Yes, blessings. And yeah, of course, we monitor the vital signs, the blood pressure, all of that. But this video was not really geared towards teaching people that. It was just to show you how you deal with the older people so them don't get pneumonia and bronchitis and aspiration pneumonitis and stasis pneumonitis and all of the itis them. All right? So, be blessed. Take care. Bye.